Initially we didn't know what to expect, and we really were afraid that our children who are getting chemotherapy would have much worse disease if they were to catch it. We were very prepared to take care of very, very sick children with COVID. But what we have learned through this pandemic is actually even our patients seem to do rather well, seem to tolerate having the infection pretty well. Not that they need to go out and get it, but we've been lucky that we haven't seen severely ill children. And so we have been working now to figure out how do we continue their cancer care? How do we make sure that our other patients are kept safe? And how do we move forward? So our clinics are now back open with some restrictions. And I think the really hardest restriction that we have is that we have gone from being a very open clinic where we welcomed our patients, bringing parents and grandparents and siblings and even friends came some of the time, to really having to shut down how many patients that we could have in our clinic and how many accompanying people could come. So now we very strictly only allow one parent to come with each child so that we don't have as much overcrowded waiting rooms and we have fewer people potentially bringing the virus into the clinic.
And I'm sure families of pediatric cancer patients are especially worried if their child would become positive with COVID. How are you easing their fears about getting the care they need and keeping everyone else safe?
I hope they're reassured by the fact that we have all these new rules about visitation and about wearing masks. Because so much of the planning happens behind the scenes, I'm not sure it's always obvious to our patients how much we're doing. But Penn State Children's Hospital has really come together as a team to provide great care to our patients. We have regular meetings with nurses and with a variety of doctors, including doctors from our ICU and our hospital medicine doctors and our emergency medicine doctors, and really critically our infectious disease specialist doctors. And we're always looking at how do we provide that care? How do we make things work? And I think one good example is that we decided very early on that when our patients had fevers, we could no longer bring them into our clinic because they could have the virus and we wouldn't want to bring the virus into our clinic. And so we worked together as a team with many different people across the hospital, but most importantly, our emergency medicine colleagues, to make a streamlined way for our patients to be able to get into the emergency room, isolated and taken care of without being exposed to too many people within the emergency room.